All right, well, good afternoon and welcome to the Madison VA Teletown Hall. We hope you stay on the line with us today as we have updates from our leadership team, a COVID update, information on our whole health program, an update on our new workplace violence prevention campaign, and information about our new VA Health Connect program, followed by a live question and answer session. We want to remind everybody on the call that the Madison VA is hiring. If you or someone you know is looking for work and has a passion for healthcare and serving veterans, we have a variety of jobs open right now. Visit usajobs.gov and search for Veterans Affairs jobs or call us at 608-256-1901, extension 17483 to learn more. And if you haven't already done so, we highly encourage you to upgrade your MyHealthyVet account to premium status. There is no cost to you, but upgrading to premium status allows you to order VA prescriptions in bulk, view VA medical records and imaging, create customized downloadable medical records, communicate directly with your healthcare team, and file, edit, and review travel claims. Upgrading your account is free and easy, but it must be done with the help of VA staff. Contact our MyHealthyVet coordinator at 608-280-7173. That is 608-280-7173. Well, thank you, everybody. We're done dialing all of our veterans, and we appreciate everybody that has joined the call. We're going to get started here in just a minute. I want to let everybody know that my name is Abe Rabinowitz. I am the Assistant Director of the hospital, and I'll be moderating this afternoon's call. Today, we're fortunate to have a panel of Madison VA's leadership team here to answer questions and provide updates. This includes our brand new director, Christine Kleckner, our Chief of Staff, Dr. Ryan Marsh, Dr. Guadalupe Mejia, our Acting Associate Director, our Chief of Medicine and Infectious Disease, Dr. Chris Cernich, our Chief Mental Health, Dr. Tim Jurgens, our Chief Patient Administration Service, Liana Torres, our Chief Social Work, Stephanie Schilling, our Veterans Experience Officer, Chad Casey, and Sarah Rogers from our whole health team. We really hope you stay on the line with us this afternoon, and we encourage you to participate in the question and answer session that will follow. If you'd like to ask a question, just press 0 on your phone at any point during the call, and you'll be connected with the staff person who will take your question and get you into the queue to speak with our panel. The Q&A session will be toward the end of our call, but you can press 0 to get in the queue at any time. If you do get cut off, unfortunately, there's not an easy way to rejoin, so please do stay on the line. And we like to start these teletown halls out with a message each time from our director, and we have a newly appointed hospital director, Christine Kleckner. Christine, welcome to the call, and we'd like to turn it over to you.
Thank you, Abe, and thanks to all of you for joining us on the call today. I'm truly honored to serve as the new Madison VA Hospital Director and to lead this amazing organization. For those of you on the call who do not know me, I have a long history of service to the Madison VA. I started early in my career as a dietitian here in Madison before moving into positions of increasing responsibility, including service as a Madison VA Assistant Director and most recently the Associate Director. In my more than 21 years of service to Madison veterans, I have seen amazing transformations of our hospital, and I am awed by the innovations our staff bring to the table to expand the scope and quality of services we provide to our veterans. I hope that as our patients, you have experienced these positive changes personally. In town hall calls like this one, we aim to provide you with updates on those innovations and opportunities for you to ask our leadership questions and help us understand how we can continue to innovate and bring you the exceptional healthcare services you have earned through your service to our country. Before I get to introducing today's agenda, I want to make sure all veterans are aware of 2 major activation projects we have planned for this spring and summer. In spring 2024, we plan to activate a new VA clinic in Vera Booth that will double the size of our old clinic and bring new access to services. After we activate that new clinic, we will begin counting the days to activate a brand new East Clinic in the summer of 2024. The new East Clinic will be over 30,000 square feet in size and include a multitude of services, including primary and mental health care, physical therapy, additional specialty services, podiatry, nail care, telehealth, wellness, and whole health, and Women's Health Services. The East Clinic will supplement services at our West Clinic and significantly expand access to care to veterans on the east side of Madison. Letters to affected patients will be going out in January with information about how to change providers or locations if you choose to do so. We are so excited to be able to bring these new resources into service and look forward to providing you with additional details as we approach those activation dates. Today, we have 4 updates planned for you, and we are trying to package them all into a loose holiday theme. We have, first, Dr. Sternich is going to present to you an update on where we stand with COVID in our community and safety precautions for COVID and seasonal influenza around the holiday season. The second is Sarah Rogers joins us to talk about our whole health programs and strategies for managing the annual stressors that come with the holidays. Third, Abe Rabinowitz will talk about a new campaign we are rolling out to promote respect and safety in the workplace. Reminders that we can provide better, more effective health care in an environment built on the foundation of mutual respect and free of violence or abuse. And fourth, Dr. Mejia will update you on our VA Health Connect program and an expansion of phone-based services we now provide 24 hours a day, 7 days per week. In between the presentations, we will have some poll questions for you, and we will make sure to allot time for your questions. I want to wish you all a safe, happy, and healthy holiday season. Thanks, Abe. Now back to you.
All right. Well, thank you, Director Kleckner. And as Christine mentioned, first on our list of updates is our Chief of Medicine and Infectious Disease, and a common commentator on our calls to give us an update on COVID and safety precautions heading into the holidays, Dr. Sternich.
I wish I didn't have to be here.
Yeah.
Unfortunately, yes, we are in the respiratory viral season, although it seems like we've been continuously in a viral respiratory season since 2020. I think everybody is aware that COVID-19 activity remains high. Here at our VA, we monitor activity using a number of metrics, including wastewater data, which does correlate very well with regional cases of COVID identified in healthcare systems. We have been seeing an ongoing climb in COVID cases reported since the end of August, and we were hoping that we would see a downward trend in the month of October, but we resurged in November, likely as a result of colder weather, people moving indoors, and holiday starting to lead to increased gatherings. And as a result, we can probably expect COVID activity to remain high through January. We are also seeing this reflected in the actual number of veterans who are presenting to our clinics, emergency department, and hospitalizations. For point of reference, July was our lowest month of COVID-19 activity since the pandemic began, with a total of 19 cases identified at our VA, which was amazing. Unfortunately, we've seen a tenfold increase in our cases in the subsequent months, and for point of reference, we're averaging about 140 to 200 cases identified at our healthcare system pretty much every month. That should be kept in mind that those are people who are seeking healthcare, and so certainly is an undercount of the number of veterans who are developing COVID-19. So the big take-home message, a lot of COVID still circulating in communities, and we would strongly encourage you to seek medical attention, particularly if you have advanced aged or a number of comorbidities, because there are treatments available that can reduce your risk of developing complications of COVID-19. Now, with regard to how do you prevent your from developing COVID-19, certainly vaccination still remains our primary tool for preventing COVID-19. We do have COVID-19 boosters available. and you should be able to schedule those through your primary care provider or by calling the VA to schedule an appointment. If you have not received a booster, which did become available in September, then please feel free to schedule an appointment for your COVID-19 booster, as we do have those available now, and we have no supply issues with COVID boosters. The other thing to keep in mind is if you are ill or if somebody in your family is ill, we would discourage you from engaging in group activities where you could spread it to others or be at risk of acquiring COVID-19. Again, there are point-of-care tests available that people can do self-administered testing at home to determine whether they have COVID-19 or not. We would encourage that we avoid interacting with people when we're ill. If you have scheduled appointments at the VA, we would recommend that you call ahead to your provider to determine whether you should come in for those appointments if you're actively ill, so we can minimize the risk to other veterans. Obviously, if you're not sure and you're here and you have some illness, we would strongly recommend that you wear a mask as a courtesy to others until you can be evaluated by your provider. Now, the other thing that I do want to touch on is we are starting to see influenza activity. And as a result of that, we can expect to see people developing respiratory illness where they're testing negative for COVID. And unfortunately, we do not have self-administered flu or other viral pathogen panels available. So if you test negative for COVID, you might have something like flu or RSV. So again, if you're of an advanced age or you have comorbidities, we would recommend that you reach out to your healthcare provider, as we can offer testing for those pathogens. And we also have effective treatment for influenza available. So again, we would strongly encourage those individuals who are in high-risk groups to reach out to their healthcare providers for further evaluation and management. We also have vaccines for influenza and RSV. RSV is a new addition to our toolkit this year, and we do have those available. Again, if you are interested in getting your flu booster or the RSV vaccine, please reach out to your primary care provider to schedule an appointment, as we also have those vaccines available. And I will stop there.
All right. Well, thanks so much, Dr. Cernich. And we did note that we had a question in the chat about when we would have vaccines available, and I think you answered that a couple of times. We do have the Moderna COVID booster available, and anyone who hasn't had one that needs one just has to give us a call and schedule an appointment, and we'll make sure we get that scheduled for you. So thanks very much, Dr. Cernich. Next, we have Sarah Rogers here to talk about our whole health programs and introduce you to the innovative and refreshing approach to care that we offer to our veterans. Sarah.
Good afternoon. My name is Sarah Rogers, and I am the Whole Health System Coordinator at the Madison VA. I am grateful for the opportunity to share with you information about whole health. The holiday season can bring joy and stress. The cold can make us feel cozy and calm, and it can sometimes make our worlds a little smaller. Taking care of yourself is an important strategy to maintain wellness during these dark months. Whole Health partners with veterans to support them in achieving their healthiest, best lives. You may be wondering, what makes Whole Health different? It centers around what matters most to you, instead of what is the matter with you. The goal is to focus care around what a veteran values most, to empower and equip them on their personal path to health and wellness. One Marine Corps veteran, Raleigh Carruthers, recently had his whole health success story shared on our Madison VA Facebook page. Following his time serving in Vietnam, he had back pain and ringing in his ears, as well as other challenges with his physical and mental health. Through meditation classes and gratitude practices, he was able to positively change his day-to-day life. He shared that he has been given the gift of taking care of himself. He added, "Now my glass is more than half full." Whole Health is a shift in the way VA staff and veterans approach care, and is not something that happens overnight. In fact, it is possible this is the first time that you have heard about whole health. I would like to pause to ask those of you on the line to respond to the following questions using the keypad on your phone. Have you heard or seen information about whole health during your care at the VA? Press 1 to respond, this is the first time I've heard about it. Press 2 to respond, I have heard about whole health before. Press 3 to respond, I know about whole health, and I am getting whole health care that supports my wellness and goals. Repeating the question, have you heard or seen information about whole health during your care at the VA? Press 1 to respond, this is the first time I've heard about it. Press 2 to respond, I've heard about whole health before. Press 3 to respond, I know about whole health, and I am getting whole health care that supports my wellness and goals. The responses are coming in. Good. Looks like 63% of you are hearing about it for the first time, and 26% of you have heard about it at some point during your care in the VA, and 11% know about whole health and are getting whole health care that supports wellness and goals. Thank you for your responses. You may notice us starting to ask, what matters most in your life? Or we may talk to you about self-care and integrative health approaches like meditation or Tai Chi. These conversations do not replace standard care and treatment. They enhance it by putting your values first and supporting your wellness journey. I'd like to pause and ask another question that you can answer using the keypad on your phone. How do you prefer to learn about whole health? Press 1 to respond, directly from my healthcare team. Press 2 to respond, at my own pace, from handouts, educational resources, and websites. Press 3 to respond, I don't need any additional information about whole health. The question again, how do you prefer to learn about whole health? Respond 1 for, directly from my healthcare team. Press 2 to respond, at my own pace from handouts, educational resources, and websites. Press 3 to respond, I don't need any additional information about whole health. Thank you for your responses. It looks like 56% of people on the call would prefer to learn directly from their healthcare team. 39% of people on the call would prefer to learn it from handouts, educational resources, and websites at their own pace. And 6% of people on the call feel they don't need any additional information. There are many self-care approaches that have been shown to help people manage stress, stay healthy, and be more resilient during busy times like the holidays. I'll mention a few here, and we'll provide contact information afterwards for those interested in joining us. Please note, spouses and caregivers are welcome to participate side by side with veterans in wellness programming. The MOVE program assists veterans focusing on weight management goals. GeroFit is an exercise program for veterans who are 65 and older. The Empower program partners with veterans who have chronic pain, providing tools and skills to help improve functioning and quality of life. The Integrative Health and Wellness program offers a variety of movement and mindfulness-based classes. There are also individual services like health coaching and functional nutrition, and many more to choose from. I'd like to pause one last time to ask for your feedback using the keypad on your phone. When it comes to health and wellness services, what is your interest level? Press 1 to respond, I'm unsure if I'm interested in learning more. Press 2 to respond, I'm interested in learning more. Press 3 to respond, I am already involved in wellness services like these. The question again, when it comes to health and wellness services, what is your interest level? Press 1 to respond, I'm unsure if I'm interested in learning more. Press 2 to respond, I'm interested in learning more. Press 3 to respond, I'm already involved in wellness services like these. Thank you for your responses. It looks like 23% of our callers are unsure if they're interested in learning more. And for people interested in learning more, 56% of you would like more information, and 19% of people on the call are already involved in wellness services like these. These icy days around the holidays can be a wonderful time to try something new and positive in your routine. If you'd like an introduction to whole health, call us at 608-256-1901 and dial 12537. Once again, that number is 608-256-1901, extension 12537 for an introduction to whole health. I thank you for your attention. We wish you and yours a happy and healthy holiday season full of the people and experiences that bring you joy.
All right. Well, thank you very much, Sarah. We really appreciate that update. Certainly focusing on what matters to us is a great reminder during the holiday season. We're thinking about family, community, and how we can make the next year better than the one before it. So we encourage all who are interested, and it seemed like there were a lot of people who this was a new concept to, so I'm really glad that we had this on this program today, to take Sarah's advice and call for a consult if you're interested in learning more about whole health. That number, again, is 608-256-1901, and the extension is 12537. And while we are talking about opportunities for how we can improve in the next year, we want to make all veterans aware of a new campaign we're rolling out to address growing concerns about violence and abuse in the workplace. A recent poll of our staff indicated that over 50% of respondents had either experienced personally or witnessed violence or abuse in the workplace. I think we can all agree that that number is too high. This problem is not unique to our VA or the VA in general and affects healthcare facilities all over the country. We hope everyone on this call understands that it is not possible to optimize our healthcare service in the presence of disruptive behavior and abuse. We do know that being in the hospital creates stress. We know many of our veterans bring a lot with them when they come to us to seek service, and we're aware of the stresses that a new diagnosis, management of a chronic condition, or simple frustration with bureaucracy has the potential to create. However, there is no excuse for abuse. The Madison VA wants to ensure that both patients and staff feel physically and psychologically safe because, as we know, disruptive behavior negatively impacts the quality of the health care we can provide to you. So knowing those factors, we're working hard to develop positive messages to help everyone understand that safe staff can provide better care for our veterans. So we created signage to encourage positive, respectful communications and an environment of mutual respect. You will begin seeing these when you visit our hospital and clinics. You may see a calming poster of a caregiver and patient practicing respect, or signage outlining expectations of behavior, or a photo of a nurse reminding patients that violence and abuse should not be part of their job. These images will be placed around the hospital and clinics to remind all of us that we can provide better service when we're working in a safe environment built on mutual respect. We want to make that commitment to all of you and are asking the same of all of our veterans. We know that the vast majority of our veterans adhere to this core principle, but we also recognize that each of us is vulnerable to frustration and anger. We're hoping that these messages remind us all that we can serve one another better when we operate in partnership, free of the threat of verbal, physical, and emotional abuse. We look forward to sharing more about this campaign in our newsletter, on social media, and on other forums, and invite everyone to be part of the solution in making our hospital the best possible place it can be for veterans to receive their health care. And now, before we move to the question and answer session, Dr. Mejia is going to provide a brief update on expansion of services available through VA Health Connect. Dr. Mejia.
Thanks, Dave. I want to take a few minutes to brief you on a new initiative that greatly expands veterans' access to phone services that you have likely noticed when calling into our medical center or one of our community-based outpatient clinics. This new initiative is called VA Health Connect. This new program enables veterans to access 3 core services 24 hours a day, 7 days a week. This is important as we have not been able to offer these services around the clock in the past. 24/7 services now include pharmacy services to refill and renew prescriptions, ask medication-related questions, receive medication education, and review treatment plans. Primary care scheduling and administrative support to help veterans make, change or cancel appointments, relay a message to the Veterans Care Team, and receive additional information about VA services. And clinical triage, previously known as telephone care service or nurse advice line. Veterans can talk to a registered nurse and discuss new or worsening medical or mental health concerns and receive recommendations for healthcare needs. This may also include virtual clinic visits with a VA Health Connect medical doctor by phone or video without having to come into the clinic. Last month alone, almost 1,000 veterans were able to get their needs met without ever having to step foot in a hospital or clinic. The VA Health Connect professionals can be reached by dialing your VA care facility and selecting option 1 for pharmacy, option 2 for scheduling, or option 3 for clinical triage. Please note, primary care scheduling is currently not available on holidays, but this service will be added mid-2024. All of the other services are now available even on holidays. The next time you call, you may notice a different voice answering from our new centralized service. We know this may not be the person you're used to speaking to, but rest assured the VA professionals you speak with have the same tools and training to assist you with your needs. You and your fellow veterans will continue to have access to the full range of in-person services at your local VA healthcare facility. And as a reminder, VA Health Connect services are not a substitute for emergency care. Veterans with medical or mental health emergencies should call 911, the Veterans Crisis Line at 988, or visit the nearest emergency department. We also encourage you to use My Healthy Vet to contact your care providers directly and in a prompt and efficient manner. You can learn more and register for My Healthy Vet by visiting www.myhealth.va.gov. VA Health Connect significantly broadens veterans' access to services with much greater flexibility and right when you need them. If you are used to calling during busy daytime hours, you might want to try us off hours, and we expect that you'll receive even faster service. We appreciate your patience and support as we continue to work on improvements to better serve you.
Well, thanks very much, Dr. Mejia. And those are the updates that we had for all of you. That last one, we promised a loose holiday theme and additional 24/7 phone services for veterans. Certainly sounds like, certainly a broad expansion of services that you guys can now access to connect with us and get your care. So now it's time to move into the question and answer part of the program. So if you do have a question, just a reminder that you can press 0 on your phone and get connected to one of our screeners who will take your question and put you in the queue to speak. But we do have a few prepared now, and the first person we have is Franklin from Reedsburg. Franklin, please go ahead with your question.
Yeah, I'm from Reedsburg, and I'd like to know how I get a hold of travel, because every time I call travel, I get a different number.
Hi, Franklin. This is Liana Torres. I'm the Chief of the Patient Administration Services here in Madison. I'm sorry that you're having difficulty reaching us. You can call the main number at 608-256-1901 at extension 11919. That is extension 1191. And there you...
Can you hang on 1 second? I got to get a pen.
I'm sorry. Of course. Let me know when you're ready.
Okay. I need the extension number.
Sure. It is 11919.
11919. Now,
yes, and that is for the travel department. And there, if you don't get a hold of somebody answering right there, you can leave a voicemail, and then we're striving to answer those within 2 business days. Now, if that doesn't serve your purpose and you would like to talk to somebody right away, you may try the main social work office, and that extension is 1 17085, and they can also assist you. 17085.
17085.
Yeah, that's for social work. They have another way of connecting with us, and they can put us an electronic request that we can see also, and we can help you with a ride.
I'm a disabled veteran. I don't drive. I'm a disabled Vietnam veteran, and I have so much trouble in the last year of getting a hold of somebody. I get an appointment, and I get somebody on the phone, and they said, don't leave more than one message, and then they don't show up. That's the problem I have.
Yeah, so Frank, thank you for raising that. One of the things we've really tried to do over the last several months is improve the responsiveness that we provide to people, and that new extension that Liana mentioned, 11919, is a service that we recently implemented where we are making sure that we're getting back to veterans within 2 business days. So that is a newer service that we have here, and part of our commitment to making sure that we respond timely to veteran concerns, not only about transportation, but also travel payments. So thank you for raising that. And for everybody else on the line, please be aware of that number as well if you have a travel or transportation issue. All right. Our next caller is Randall from Kirkland. Randall, please go ahead with your question.
Good afternoon. I had surgery at Middleton Hospital in Madison September 15th of last year. Then I had to have another surgery done December 15th of last year at Madison Hospital as well. I'm still in a wheelchair, and my orthopedic doctor at Hines tells me that it doesn't look like I'm going to be able to walk, but yet I have had no assistance from the VA at all. I'm not the one that put a 1.25 inch short hip in me the first time when they put a temporary hip in, and then my second surgery they had to cut a 1/2 inch of my femur out, and now there goes my post-surgical therapy. I live in a wheelchair, and they've yet to help me out doing things. So what's up?
Hi, Randall. This is Stephanie, the Chief of Social Work. I'm sorry to hear that you are still having problems with your physical recovery after your surgeries. I think what would be your best option is for us to talk offline and do an assessment of what you can and can't do, and then we can help come up with a plan with your primary care provider and the surgeon about how we can move forward and get you into the best shape that you can be in given your physical situation.
And I thank you very much. I'm sorry.
So if you're able to and you have a pen and you want to call the social work office, I'll get you hooked up with one of our social workers. Do you have a pen handy? Okay.
Go ahead.
608
Yes.
256
Yes.
1901 extension
go ahead.
17085.
Okay.
And we'll help you get situated.
All right. Here it goes, 608-256-1901. Yeah, I know that number. I've called it many times. Extension 17085. And I appreciate your candidness, and you said we talk offline. Go right ahead.
Okay, yeah, give us a call, and then one of my social workers will do an assessment, and we'll work with your team and come up with a plan.
Thank you very
much. To see what you're
much.
eligible for and get you better.
Yeah, I'm also a disabled veteran too. So anyway, thank you very much.
Thank you for your service.
Thank you very much, and I will call that number right now, ma'am.
Okay. Thank you.
All right. Thanks very much for that question and for the response, Stephanie. We appreciate it. Our next call is from Rich in Mount Horeb. Rich, go ahead with your question.
I would like to know when the VA is going to offer dental care for all vets.
Rich, that is a very good question, and one that we absolutely cannot answer on this call. We know that access to dental services is something that people have been anxious for a long time, but it is the law that we have to follow in terms of eligibility for that. So while we can't answer that or give you an indication of when that might happen on this call, it is something that you can always lobby for. And as part of your right to indicate your preference to either your local elected officials, but that would require a change in law in order for us to be able to allow for that. So Stephanie, you wanted to add to that?
Hi, Rich. It's Stephanie again from Social Work. If you're having trouble affording your dental care, you can call Social Work, and we have some resources that we can refer you to for community services where you can get low cost or reduced dental care in the community that's not associated with the VA. So we deal with that often because, as you know, dental care is restricted here at the VA, and so we do keep some resources out in the community for our veterans who still need the dental care and are having trouble paying for it. So do you need the phone number for the social work office?
Yes, ma'am.
Okay. Do you know the main hospital number?
Yes. I'm not by
Okay.
heart, but I do have it.
Okay. It's 608-256-1901. And then social work is at extension 17085.
Okay. Yeah, I just
And
don't
we'll try to get-
understand why it's not offered to all vets. I just can't understand that at all.
Yeah, we know that that's a point of dissatisfaction with many, but it is the rule and regulation that we have to follow. And thank you, Stephanie, though, for offering some alternatives. We don't want to see anyone going without, and part of our social work team's responsibility is to connect people to services. So please do connect with them, and we'll see what we can do to help you. Okay, our next question is outside of our screener queue, but it's from Jason in Janesville, who asked, in general, what changes can we expect from the new director and the administration in 2024? So, Christine, we'll turn it over to you to answer Jason's question.
All right, well, thank you, Jason. That's a really good question. But I just want to let you know, I wouldn't expect a lot of changes. We're currently a very high-performing and innovative healthcare organization. I have been the assistant director and associate director here for the past 12 years, so really the chief operating officer. We have a very stable executive leadership team. We all work very well together. We have phenomenal service chiefs, leaders, and staff. So we will continue focusing on our top priorities. Number one, really veterans experience. We always work on improving by listening, like today, listening to your feedback today, and we receive lots and lots of feedback, so we always want to improve. Also, it's really important to us that we provide as much care as possible here within our organization, whether it's at our main campus, our CBOC, it's done virtually. We want to provide as many services as possible. And then we're always looking at areas where we need to expand. So I could talk for a long time, but we're going to continue to do great things here, and I just feel very confident with our staff and the passion that I see every day here. So thank you so much, Jason.
Thanks, Jason, for the question, and thanks, Christine. We're certainly excited to work with you to make all of those things happen here. Our next caller is David from Stoughton. David, please go ahead with your question.
Hi, this is David from Stoughton, and the reason I wanted to call in is because of my experience at the VA hospital and clinic. I live in Stoughton, so not far away, and I just wanted to say thank you for the kind, caring care that I've always received from any contact that I've ever had in the hospital. I'm 50% disabled, so I do get in there for a number of different things. And I just wanted to tell you that I think it's the best care I have ever received in my life. And I appreciate all you do, and I think you're doing a wonderful job. I just felt it was important to let you know my experience and the fine job that you do. So thank you so very much for everything you do.
Well, that was certainly a wonderful and appreciated call. So thank you, David, and I know it's the pleasure of our staff to serve you and provide you with that excellent care. So thank you for your question. It wasn't really a question, it was more praise, but we appreciate it very much. The next caller that we have is Tim from Reedsburg. Tim, go ahead with your question.
Yeah, this is Tim from Reedsburg here. I'd like to, kind of echo the remarks of the last caller there, in that I've been very, very appreciative of the great things that the VA has done for me. In July of next year, I turned 65, so, I got, to sign up for Medicare. And I actually like the VA. I don't really want to do Medicare, actually, but, what is the ramifications of, not, of staying with the VA and not doing Medicare, or how does that all work? I guess I just don't know what I should be doing, for moving on ahead, when my time comes to sign up for, Medicare there.
Hi, Tim. This is Stephanie from social work. Congratulations on getting close to Medicare eligibility. That's exciting. Your question is the question that we get a lot for folks in your same situation. We have a lot of veterans that have Medicare eligibility, and they don't want to mess anything up, and so they do want to know whether or not they should stay with the VA, if they should get Medicare, not get Medicare. Are there penalties later on if you need Medicare but you don't have it? Does Medicare give you extra coverage that the VA doesn't provide? It's really based on your unique situation. And so what I'll invite you to do is to call the social work office, and we can have a social worker sit down with you and give you all of the options so that you're educated and you have the information, and then you're going to have to make that decision. We can't actually tell you what to do. We can just give you all of the pros and cons, and then hopefully you'll get enough information that you'll know what to do. Because it is really case dependent on your particular situation.
Right. What's the social... Pardon?
Go ahead.
So what is the social office number again?
Yeah, I'll give you the main hospital number first. That's 608-256-1901. And then we're at extension 17085. 17085.
Okay, 17085. Have you experienced quite a few veterans that have opted out of Medicare and stick with the VA?
There are some people who do that because of their unique situation. And then there are other folks that decide to do both so that they have both to use in the future. And it really is tricky. So it's good to get all of the information and make a decision for yourself based on your your own financial situation and medical care.
Okay.
So we'll look
right.
look at it with you and give you the info. Thank you.
Thank you.
All right. Thank you for the question. Our next caller is William from Sun Prairie with a question about travel. William, go ahead with your question.
Why do I have to go to a new, different website to file a BTSSS claim? That's question number one. Why can't I just stay on My Healthy Vet? The second part of that is every time I have succeeded, I've been disapproved, and I'm never told why I've been disapproved. And the third part is, my last visit to the Madison VA, I went to the travel desk where they have those computers, and the gentleman that was assigned to help me couldn't find my appointment on the BTSSS website for that very day. And I went on My Healthy Vet, and I showed him, well, right there is my appointment that I just finished. So I find that it's not working very well.
Hi, William. This is Liana. I'm the Chief of the Patient Administration Services. I'm not going to lie to you. We have had a lot of glitches with this software from the beginning. They have gotten better, but we're still going through some changes. We get some releases from the developer every 2 or 3 months, and they keep making it better, but we're still getting through some issues. I'm not sure what you're referring to, a different website. I know some veterans use My Healthy Vet as an option to log in to BTS3 as the main hub, but I think off the call, we can get your information and I can get you with an expert, and then your answers can be better answered, because I don't want to discourage you from using the portal that can get you faster payment resolution, and get you using a paper claim just because you're getting frustrated with the software because we weren't able to answer your question effectively. I thank you for giving it a try and for bringing to our attention the issue that you're having with the software. In regards to the appointments, I've seen this happen. I really don't have, again, the answer for that. I know it happens with certain clinics that we cannot see the appointments, and it happens with the veterans on their phone when they're trying to do it on their personal cell phones also. I wish I had the answer. The best solution that I can give you is that I can get you an expert and give you a one-on-one, and that way we can get all of your questions answered. And again, I really thank you for giving it a try and bringing it to our attention. We'll get your information after the telethon hall is done.
Oh, well, yeah, we can look that up. But William, also remember, and for everybody else on the call, if you do have a travel-related issue, you can call our main number, 608-256-1901, and use our extension 11919 as a way of making sure that we make contact and answer any open questions that you have about travel. So
yeah, you can leave us a voicemail, and then we'll return your call within 2 business days.
That's patient services, 11919?
That will be the travel office.
Thank you, Liana.
Thank you.
All right, our next caller is, where are we going? Our next caller is Tom from Baraboo. Tom, go ahead with your question.
Yes, I recently got the latest COVID shot, and I'm just wondering, is there how long it will last, and if there will be a follow-up to it?
Yeah, hey, this is Dr. Marsh. Great question. So it's a newer type of booster, and so I'm going to hedge a little bit because I think we're going to have to see how things play out. The initial study suggests that probably the immunity, so its protection against COVID, drops off after 3 to 6 months, somewhere in that range. And it depends, though, on what you're looking at. If you're looking at protecting you from dying, that actually probably lasts longer versus just getting sick probably doesn't last as long, but likely somewhere in the 6-month range. But that's also the issue is there going to be a new variant, right? So if a new variant comes out and that wasn't covered in that particular booster, then it's not going to be as protective, right? So great question. Likely through the cold and flu season, and then next year they'll be reassessed, and then looking at the newer variants.
In your opinion, do you think that COVID in the future will be treated like the flu, that there's going to be something different through each different season?
I mean, that's what people are talking about, that this is going to be an ongoing thing for years to come, that we're going to be seeing similar to the flu, that you're going to be seeing a COVID vaccine addressing the most recent variants. But, again, it's so new, we just don't know exactly what's going to happen.
Yeah, I can understand that. And again, I'd like to say thank you to everyone I've ever worked with the VA, and I just can't get over how good the system is. Compared to when my dad was with it 40 years ago, it's totally different.
Well, thank you so much, Tom. That's certainly a wonderful compliment that we always love to hear. It's our pleasure to serve you. Our next caller is Angelo. Angelo, you had a follow-up question about whole health.
Hi, this is Angelo from Madison. And I was just wondering the extension actually for that whole health again.
Yep, this is Sarah Rogers, the Whole Health System Coordinator, and it's the main VA hospital number, 608-256-1901, and then the extension is 12537.
Thank you. And my second question was for more home health thing related. If there's people we know or agents we know of, how do we get to use them as patients?
Are you talking about a home health agency that would come into a veteran's home and provide services?
Correct. Maybe like after a surgery or, rehab for a period of time.
And you want the VA to pay for it?
If there's any type of way there that, there's a system that they can, address or be in.
Yeah, so that's going to be another phone call to the social work office where we can do an assessment based off of what your needs are and then work with your primary care provider or your surgeon or your specialty clinic to really decide what programs you might be eligible for that the VA funds for services in your home. We don't pay for everything, but we do pay for some things. And so we should first do an assessment, and then we can hook you up with, if you're eligible, we can make a referral to the agency of your choice, and then we can pay for it if that agency is part of our network. And if that agency is not part of our network, then we would likely ask the agency to become part of our network. But if they're not part of our network, then we can't pay them. So it's a process, but you'd start with calling social work and having us really figure out maybe what you need or what the person you're talking about needs. Do you? Let me just give you the extension one more time for social work. 17085.
Okay.
Thank you, Stephanie. Appreciate that. We have gotten a couple questions in the chat about the discussion on workplace violence. So I'm just going to turn it over to our Veterans Experience Officer just to make some comments about our experience here at the VA.
Sure. Thank you, Abe. My name is Chad Casey. I'm the Veteran Experience Officer here in Madison, VA. It was just kind of a general message. Unfortunately, in the healthcare setting, we've seen an increase in violent, disruptive behaviors. Unfortunately, the Madison VA is not immune to that, and we've seen that uptick as well. And, we're caretakers here. We have people that want to take care of people. And we've just seen kind of an increase in some potentially disruptive or violent situations. It's just kind of a reminder to all on the call that we're human too, right? We're trying to take care of everybody within our building. As a veteran walking our halls, if you see something, say something, right? If something doesn't look right, doesn't seem right, say something. And conversely, if you have staff that are not treating you the way you want to be treated, that's something we'd want to know about too, through the patient advocate office. So just kind of a general message. It's a place of business. We're trying to take care of people, and unfortunately, the situation in the world we live in today, there's been kind of an uptick in disruptive and in some cases violent behavior that kind of takes away from what we're trying to do here within the walls of our hospital. So that's just kind of a general reminder. No one's doing anything wrong. We're not trying to tell anybody you're doing anything inappropriate or wrong. Just a reminder, current state of where we're at, right? It's current state of where we're at. And it's just kind of helpful to have that 360 perspective. So thank you.
Yeah, thanks, Chad. And we do know that this certainly doesn't apply to everybody. The vast majority of people who walk through our halls here are extremely grateful for their care. And the vast majority of our staff are really happy to treat patients. But we all know that those can go sideways on both from both perspectives, and we're just trying to do everything we can to minimize that here in the hospital. Now, we do have one fun question for everybody as we come to a close that we thought we would add, because this is a big weekend for some. So the question that we have, and again, you can answer with the buttons on your phone, is who's going to win the Army-Navy game this weekend? If you think Army's going to win, press 1. If you think Navy's going to win, press 2. And if you think somebody other than Army or Navy are going to win, or it will be a tie, press 3. Oh, it's pretty even out there, everybody. We're just a little bit. If there are Navy people out there, you could get your press number 2 now. It's looking pretty solid at about 55% for Army and 45% or. Yeah, 45% for Navy. Just a few of you had other on there too, but it's 1 o'clock, and that's all the time we have today. We had some really great questions, and I think some really nice presentations for all of you. We appreciate everybody who stayed on the call with us today. Thank you very much for your service and for choosing us as your healthcare provider. We wish you all a happy holiday and look forward to seeing you at our hospital again soon. Thank you.